Hola, North Carolina. This is Linda Wilson and I'm with Rocío Anderson, who is the Director of Maternal and Child Health Education at March of Dimes. Can you tell us a little bit about what March of Dimes is and how long have you guys been working?
So March of Dimes leads the fight for the health of moms and babies. We believe that every baby deserves the best possible start. Unfortunately, we also know that that's not always the truth. For the last 80 years, March of Dimes has helped millions of babies survive and thrive, and now we're building on that legacy. We want to make sure that no matter what your situation is, you have the opportunity to have the healthiest baby possible. We also want to make sure that every woman is at their healthiest before they think about becoming pregnant.
Now tell me, why is it important to be at your healthiest before you're pregnant?
Well, there's a misconception that, oh, I'm pregnant, now I need to take care of myself. And the fact of the matter is that you should be thinking about that way before you even think about having a baby. A number of poor pregnancy outcomes are associated with potentially preventable risk factors that can be identified. If we know them early enough, we learn how to manage them. And if you have a relationship with a medical provider or a medical home, then you will be able to manage this risk and be at your healthiest before you become pregnant. It is important for women to go to the doctor at least once a year, have a well-checked visit. And again, whether you're planning or not planning to be pregnant, make sure that you have this conversation with your doctor. We'd recommend that every woman should take at least 400 micrograms of folic acid every day. And you can consume folate from fruits and vegetables, but we also need the multivitamin that has this folic acid included.
Now tell me, what does the March of Dimes North Carolina Preconception Health Campaign do?
So our campaign is statewide and aims to educate providers that work with men and women of reproductive age to ensure that they both reflect on and start thinking about having a life plan that includes a reproductive life plan. So we know that over 40% of pregnancies are unplanned, and we want to make sure that women and men think about becoming pregnant and that are at their healthiest before this happens. We want to ensure and avoid neural tube defects, and in order to do that, we need to make sure that these conversations happen with the providers and that the community has the information way before. So how do I get this information? We take this information to the community and the providers and talk about the health behaviors that we currently have and what we should be doing to be at our healthiest. Taking a multivitamin every day, visiting your doctor at least once a year, ensuring that this education starts not right before you want to get pregnant or once you've become pregnant, but at the age of middle school age or in high school. Most of the programs that we take to the community and to the providers. We have education that we do with medical providers that serve this women and men of reproductive age in person, and we also do it via webinar, and we also educate community members at their community-based organizations. We have a school curriculum that we take to middle schools and to high schools. Our program is called Community Ambassadors Program, and what we do with that program is educate men and women of reproductive age, again, about the benefits of folic acid and how this can avoid neural tube defects. In turn, these community ambassadors educate their peers in their local communities or schools.
And is this campaign bilingual?
Yes, we work with our providers and our community in English and Spanish. We have a community ambassador program, and it's where we go to the colleges and educate the college students, and they in turn educate their peers. And we also have the Promotoras program, which we educate women in the community and the topics of folic acid, neural tube defects, how to maintain a healthy weight, and how to build a reproductive life plan.
Rocío, thank you so much for this information. If you want to contact Rocío directly, her information is on the screen.